Thank you for joining us today for the August stakeholder meeting. My name is not Veronica Judy Cecil, as you can probably tell via Teams. She will be joining us shortly, and so we will hear from her some updates. But I'll just go ahead and give us the sort of overview of today and the lay of the land. We'll be giving some updates on what our key outreach is right now and how providers and organizations can support us through this unwinding and making sure that members can maintain coverage. First, of course, you all know this, the public health emergency ended on May 11th. And so since then, the flexibilities that were in place have been unwound, if not received approval for an extension through the Medicaid unwinding or been codified into Kentucky's policies. And then again, the main thing we're hearing in the news a lot of is that Medicaid renewals for all members resumed. For Kentucky, the first renewals were due May 31st this year, meaning they were triggered in April, and meaning that we have 4 active cohorts of members with due date and renewals that are ongoing, processed, paperwork out the door, outreach to them. So that's a lot of people, but we're making sure to track them very closely and put in all the items we can to make sure that we can continue coverage and avoid any gaps in coverage that would be unnecessary. I believe we do have Deputy Commissioner Veronica Judy Cecil with us now. So thank you so much for joining. We had just kicked off, but I can turn it to you if you would like.
Thank you, Helen. I appreciate that. And good morning, everyone. So just taking off where Helen was discussing, you're seeing the slide that's showing the Medicaid enrollment. We did start this now for January 2023, so we can just track more easily the enrollment as we go through the unwinding period. We did have that larger dip from June to July. Just to refresh everyone's memory, we did start with our prioritizing different populations throughout the unwinding period. At the beginning of our unwinding period, we did have individuals that our system had already identified or were likely ineligible. And so we have a little bit of a larger number of known individuals that were ineligible there here from June to July. And you can see that it's tapered off a little bit, still progressing down, but we're monitoring it. We're monitoring where folks are in the renewal process. What's most important to us and our priority is to ensure that if someone is still Medicaid eligible, that they're not being inappropriately terminated. So that's where we are right now. So this is a placeholder slide. This is where we would normally in our presentation start to really dig into the data. We have had a bit of a challenge with understanding CMS's requirements around the reporting. The reason for this is because we are extending, as most states are, if not all states, extending some renewals. And also we have a large number of pending renewals. So going back to May renewals, we still have some pending that are awaiting processing by our sister agency, the Department for Community-Based Services, and then our policy to extend anyone who is in long-term care or part of a 1915C waiver. We are extending them up to 60 days if we haven't received a response from them by the time their renewal date comes, so that we can provide some additional outreach to them, make sure they understand they need to submit that renewal packet. So CMS has given us permission to extend up to 60 days. All of that is creating some challenges with the CMS monthly report, because when it was developed and when guidance was issued, and I believe that was back in 2021, it did not contemplate that states would be experiencing or be permitted to extend. So we just received new guidance from CMS on Tuesday about our reports. It's requiring us to go back and make some changes to both the reports that are for the June reporting period. So our June renewals that were from June 1st to June 30th, and then our July renewals reporting period, so July 1 to July 31st. So those two reports are in the process of being amended, and as soon as those are complete, we will post that on our website like we have been. And I just don't have an ETA on when that will be. We're working on them and trying to get them completed. as quickly as possible. That's the update on our data report. We still can share with you all reinstatements. So we are tracking reinstatements. That a reminder, a reinstatement is if someone was procedurally terminated. So let's say they received a notice and didn't respond by their termination date, their renewal date. If they come in within 90 days after that date and provide documentation, they can be reinstated back to their termination date. And so we're tracking that. As you see, May, we've already had 5,100, a little over 5,100 individuals come back from our May renewals. Our June renewals, a little over 4,000 have been reinstated. And from July, we already have almost 1,500 that have been reinstated. So we're happy to see that even if somebody was terminated, they have reached out and we've been able to get them determined eligible or ineligible. But these are individuals who we were able to determine eligible and reinstate. Just reminding folks, we do have some specific priorities as we move into our 6th month of renewals. First of all, is we're encouraging households that receive a notice to please respond, especially if there are children. Children have a higher federal poverty level limit, and a lot of households don't understand that by responding to that notice, even if the parent or guardian or other member of the household is no longer eligible, that child may still be. And so we really are encouraging households to return the notice just so that we can make an actual determination, because otherwise, without responding to the notice, they'll be discontinued. We are also reaching back out to individuals who are being procedurally terminated to encourage them within that 90-day period to provide the information that was requested so that we can perform an actual determination. Again, we know there are populations that are no longer, or individuals who are no longer eligible, but having that actual determination made is more important so that we can make sure that, we've got the information that is reliable to determine that eligibility. Just the slide that we always share to try to remind folks of the various ways in which they can respond to a notice and provide information and where they can get help. We do want to acknowledge that sometimes if an individual is trying to create that Connect account, that self-service portal, there can sometimes be challenges with navigating the identity proofing that's required to create that account. If that's the case, Connector can escalate those issues through a process that we have, and so that we can work through and see what we can do to try to help that individual. We are looking right now at different ways that we can make that easier on an individual to navigate that identity proofing. I think the current policy is that they need to take some form of identification, permitted identification, in to the DCBS office so that can be reviewed. But we're looking at some other alternatives to try to make that a little easier. And we're also just trying to review and see what high level changes we can make to that identity proofing process as well. So just reminder, connectors are an amazing resource, and they're all over the state and certainly can assist someone with providing that information, navigating the renewal process or an application process if somebody needs to reapply, and in completing those forms. And as I mentioned, there are avenues for connectors to escalate issues to the department. The reminder to providers that we really need your help in being a resource to our members, checking that eligibility redetermination date, and if the member is coming into their office, if it's a current month or next month, making sure they understand that they're going through redetermination and the different ways to get assistance if they have not received any kind of communication, to call the Connect hotline or to reach out to a connector for assistance. And then for our long-term care and 1915C waiver members and clocks, providers and clocks, they can pull reports, much like Kentucky Health Net, and find out when their patients or their members are going through a renewal. We do have out on our Unwinding website the information specific to our waiver providers. As you may recall, that they are a little different in the unwinding process. We have Appendix K authority through November 11th. We're trying to keep those providers updated on what that unwinding looks like. Lots of communication will continue to happen over the next couple of months, but best thing to do is to monitor our website and just make sure that you're looking at the notices that are coming from the department about unwinding. We have recently added some additional flyers to our website. These flyers are really for provider offices, for stakeholder community organizations that interact with Medicaid members on a regular basis. We encourage you to pull those down, to post them, to hand them out. If there is different resource that's needed, certainly reach out to us. Happy to provide whatever you believe might be of assistance in helping our members through the renewal process. And the important part of somebody who is no longer eligible for Medicaid and they don't have employer-sponsored insurance is to go out and choose a qualified health plan, to get on the health benefit exchange, the marketplace, and to look for a plan. Again, a connector can help you with that, but also an insurance agent can help with that. So there's help out there for members that might need to go through that process. The tricky part here is that unlike Medicaid, you have to go out and actually choose a plan and then pay that premium for a qualified health plan for coverage to start. So, in Medicaid, when somebody is determined eligible, it's automatic. It's that month generally of application. For a qualified health plan, it's generally the next month, and you have to take those certain actions to have the coverage start. So just a reminder to those folks who might be in this situation to please go out and make sure you're taking those actions. Now, since we're talking about qualified health plan, here is our enrollment chart that you can see, again, continues to increase in general. So we're happy to see this. We want to ensure, and we are tracking members that are no longer eligible for Medicaid. We're tracking their enrollment into the qualified health plan. We're doing outreach to them, as are the Medicaid managed care organizations. They are allowed to warm transfer a Medicaid member to their qualified health plan if they have one. We're really trying to increase that enrollment number. So it's trending up, and we're glad to see that. We've been presenting on the flexibilities that came to an end on May 11th, but there are certainly still flexibilities that are continuing beyond the end of the public health emergency. Just noting that, what those are. We're going to continue to make sure that folks understand when those go away, and we'll certainly provide notice about that. But for now, we do still have a lot of flexibilities, as you can note here. And then we have added additional flexibilities as we started the unwinding period. And so these are new flexibilities that we've implemented to try to improve upon both the ex parte or passive renewal process. If you recall, that's when we can go out and ping all of the databases and determine if somebody is eligible without them having to take any action. So a lot of these flexibilities are to provide some ability to keep members covered during the unwinding period. Our plug for the website, and we really are trying to keep it robust in information, including reports, flyers, and I see that Beth has posted the link to the flyers. Thank you, Beth, for that, as well as the QR codes in the chat. But really, it's the best way for us to keep folks updated with all the information on unwinding. And if you're not already, please subscribe to one of our social media channels, Facebook, Twitter, or Instagram, like us or follow us. You don't have to do all three, but at least one of them. We generally utilize the same information across all three platforms. And then, of course, the ongoing stakeholder meetings. This one was delayed. We were hoping to have that data finished so that we could present it, but alas, was unable to do that. But please join us for next month's stakeholder meeting and look for those updated reports on the website so that you can see what the current data is. And we hope that this has been helpful, which I think is questions.
Yes, absolutely. Thank you, Deputy Commissioner. That was great. And I know that a lot of the presentation was reminders about what's going on and just updates on our current priorities. And then, of course, we will get the data up onto the website as quickly as possible. But are there any questions about any of the priorities that we mentioned today? I do know there were a couple of questions from registration about the waiver participants and providers. And I know that is evolving, and our LTSS team is diligently working on making sure that guidance is regularly updated. So please feel free to check the website back for that and their website as well. We do have a question in the chat, Veronica, about the number of renewals that are still pending from May, June, and July, and then confirming whether or not members are having their coverage extended while those renewals are pending processing by the state.
Sure. So I can say that we have about 12,000 as of around the 1st of August, about 12,000 that are pending across the May, June, July renewals. And so the way the system is supposed to work is that if they have responded and there's a response that's pending state action, they are supposed to keep their coverage. We have been made aware and been given some cases where that doesn't appear to have happened. I think especially if you're someone who's helping members through the renewal process, if you come across those cases, the best thing to do as a connector is to escalate those up. Let us check on it to make sure that it wasn't that they were disenrolled because while there was a response pending. In most of the cases that we're seeing, the reason for the disenrollment was valid. It wasn't necessarily just because there was something pending on the case. So, but we need to look at those on a case-by-case basis.
Thank you. All right. Well, not seeing anything else come in. Appreciate the update, Veronica, and really appreciate you all taking the time to listen to us. Feel free to reach out if you have specific questions or if you have any needs. Encourage you all to disseminate those flyers through your various channels, really hoping to get the messages into the hands of members and supporting them in understanding how to respond right now, since that is a lot of confusion around this, and it would be very difficult being on the member side. So we appreciate your help in that.
Thanks, everyone.
Have a great rest of your day. Thank you.